Hey future doctors, welcome back to our channel Teddy Guides You. This is Harshita, a third year MBBS student. In this video, we are going to discuss an important topic in ophthalmology, that is acute bacterial conjunctivitis. Red, itchy and oozing. Ever woken up with your eyes stuck shut? That might be bacterial infection. In this video, we will break down causes, symptoms, treatment, and must know tips to tackle this common eye infection. Stay tuned to keep your eyes healthy and infection free and to remember everything easy in your fourth year examination. Okay, acute bacterial conjunctivitis, which is also called as mucopurulent conjunctivitis. What is the definition here? This bacterial conjunctivitis is very common. So commonest bacterial conjunctivitis with red eye and pus. It is inflammation. So here you will see all the cardial signs of inflammation like pallor, swelling and loss of function. So what are the causes here? The causes can be remembered by SKPS. S for Staph aureus, K for Kochwick's bacilli, pneumococcus and streptococcus. So the most common microorganisms. What are the clinical features here? They are red eye. The mnemonic is red eye. R for red eye, E for excessive mucopurulent discharge, D for difficulty tolerating light. In simple words, it is photophobia. E for eyelid sticking together in the morning because of accumulation of pus. Y for yellow crust on lashes, and E for episodes of blurry vision due to mucus. So these are the symptoms, and the signs are fiery red eye, flakes of pus at canthi or mid eye. For example, if this is eye, you will see pus at canthi or eye margins, swelling of conjunctiva, which is a cardial feature of inflammation, petechial hemorrhages, and the most important point is you don't see any kind of periocular lymphadenopathy. So these are the signs that you must see in your patient if you suspect acute bacterial conjunctivitis. Okay, what are the clinical codes here? It is bilateral, but sometimes one eye may also be affected, and it achieves its peak in 3 to 4 days, but it resolves by 15 days if untreated. But if it is chronic, it will lead to chronic catarrhal conjunctivitis. What are the complications if it's reached to chronic state? They are corneal ulcer. They can be remembered by CBS. C for corneal ulcer, B for blepharitis like lid infection, S for superficial keratitis and dacryocystitis. Okay, and the most important point is what is the treatment that you are going to give to your patient. The treatment is very easy. First one, if you are unable to remember all the drugs, just remember the subheadings like topical antibiotics, conjunctival sac irritants, dark goggles are the drugs used here. In topical antibiotics, in first line you will give chloramphenicol 1%, gentamicin 0.3% and tobramycin 0.3%. But if the patient is resistant to the first line drugs, you quinolones like ciprofloxacin, ofloxacin and moxifloxacin. And at night time you can give ointment to prevent the stickiness of lids. Okay, second one, conjunctival sac irritation. Like you must wash the eyes with lukewarm but not frequently because it leads to removal of protective tear proteins. And for photophobia, you can use dark goggles. Dark goggles in case to prevent photophobia. And the most important point is we must not do bandages because bandages traps bacteria and they leads to severity of infection, and steroids should not be used in this condition because they worsens the infection and cause corneal ulcer, which is a complication in chronic conditions. And you may also use pain reliefs as it is red eye with pain like ibuprofen and paracetamol for 2 to 3 days. How are you going to prevent this? So for preventing, you should go for frequent hand washing caused by bacteria and avoid sharing towels, handkerchiefs and pillows. Okay, so these are the important points that you must remember regarding acute bacterial conjunctivitis. If you find this video helpful, consider subscribing to the channel to educate you. This is Harshita signing off. Thank you so much.